Imagine a situation where you are not even able to swallow your own saliva. This is what happens when you have cancer of the esophagus. I'm Dr. Joshua Delito, a family physician. I have an interest in cancer prevention and also public health. So today we are going to talk about cancer of the esophagus. The esophagus is a tube that carries food from the mouth to the stomach. Usually, cancer of the esophagus affects the lower part of the esophagus or commonly the middle part of the esophagus. And it is usually mainly affects men more than females, and it claims over 500,000 lives annually worldwide according to WHO statistics. The exact cause of this cancer is not yet known, and there is no screening method that is currently available for this cancer. Kenya is one of the countries with a heavy burden of cancer of the esophagus. So it's a very important cancer for us so that we know more about it and how to prevent it. Despite not having any obvious screening methods, there are some well-known risk factors for cancer of the esophagus, which include smoking. Smoking causes irritation to the mucosa of esophagus, causing it to undergo changes that could lead to cancer development. Then excessive alcohol intake. We have infection with the human papilloma virus. We have a diet low in fruit and vegetables. We also have the habit of drinking hot liquid. For those who have gastroesophageal reflux disease. For more information about gastric esophageal disease, you can also check our previous videos on this condition. Then we also have those who have poor oral hygiene. Obesity is also a major risk factor for cancer of the esophagus. We have infection with H. pylori. This is a common infection in the gastric mucosa. And also for those who have undergone cholecystectomy, which is removal of the gallbladder for any reason. So how does cancer of the esophagus present? Usually in the early stages, the cancer is asymptomatic, and it is at the advanced stages that symptoms present. So the commonest presentation is progressive difficulty in swallowing. And this starts with the difficulty swallowing solid foods and then followed with the difficulty swallowing fluids. You can also have difficulties even having to swallow your own saliva. We have pain during swallowing, a condition that is known medically as oesophageal. You can also have constant chest pain, which is usually felt at the middle portion of the chest. You can have regurgitation of food because there is difficulty for food to go down, then it comes back. You can have aspiration. Aspiration is food going to the airways, and this comes as a result of the food coming back, and because there could be difficulties in the swallowing mechanism, then that food can find its way to the lungs, and this can lead to aspiration. And as a consequence, individuals may have what we call aspiration pneumonia, and this can lead to coughing, and you may also have hoarseness of the voice. Then you also may have coughing of blood, not coughing of blood, but vomiting of blood. This is because of the ulceration of the esophagus. Then with the advanced diseases, individuals may become anemic, which is a condition whereby the blood level is low. They may have easy fatigability. They may feel tired. You may have weight loss, especially due to difficulties with eating. And also, of course, having cancer is a high metabolic situation and causes excessive metabolism or use of calories, and this leads to weight loss. Then we have, how does diagnosis come about of cancer of the esophagus? Of course, the initial evaluation is the history of the patient. If a patient presents to the health facility with a history of difficult breathing, difficult swallowing, which is progressive, then there is high suspicion of cancer of the esophagus. Then the doctor will do an examination, mainly looking for the general symptom like weight loss. There could also be anemia where there is low blood levels, and there is also obvious wasting if the cancer has been there persistently. Some of the investigations that can be done, of course, include blood count, which will show the blood level. Then specifically for the cancer of the esophagus, there were tests that we used to do which we call a barium swallow, where a contrast was swallowed and then pictures are taken. These days, this test is not done very much, but it was done very much previously, and at the area where there is the cancer, there would be narrowing of the portion of the esophagus, or the obstruction to the passage of the contrast. And if the contrast managed to pass through, then it would form like a large tail, which was a very crucial sign for the diagnosis of cancer of the esophagus. The gold standard these days for the diagnosis of cancer of the esophagus is endoscopy, where a thin flexible tube is inserted into the mouth to the esophagus, and it can easily detect the site of the narrowing or where the obstruction is, and then a biopsy is taken, and after the biopsy the cells are looked at the microscope. Then once the diagnosis is confirmed that it is cancer, then we have staging, and for staging we usually do a CT scan, whereby you evaluate the extent of the metastasis, which is the spreading of the cancer. Usually cancer of esophagus starts at the esophagus, then spreads locally through the esophageal lining. It can spread out to the surrounding tissues, to the lungs, and it can also go to the brain, the lungs, and to other parts of the body like the liver when it is in the far advanced stages. Then a PET scan can also be done to help determine the other sites of the metastasis of the esophageal cancer. So usually, what is the treatment available for the esophageal cancer? Usually you can have surgery for locally confined disease, whereby you can have removal of part of the esophagus, and you can also have drugs used to treat the cancer that has gone beyond the esophagus, and you can also have radiotherapy. Of course, for those where the cancer has gone widely, then there is supportive care. There is what we call stenting, whereby a tube is put in the esophagus, and this helps the individual to be able to take fluids, and usually when the food is well glided, then they can take it in a liquid form, and this helps to sustain life. And of course there is pain control. Radiation can also be used to reduce the tumor size, and also you can have a combination of all these methods of treatment. Before we come to the prevention of what you can do to prevent yourself from getting cancer of the esophagus, if you have not subscribed to our channel, I would encourage you to subscribe. Please also share this information to others so that they may also know about this condition and they may take the necessary precaution, and also hit the bell on the screen so that you are able to follow when we produce new content. You can also follow Wellness Health Services Health Talks from our YouTube channel, Facebook, Instagram, and also TikTok. So how do you prevent yourself from getting cancer of the esophagus? The most critical thing is, if you're a smoker, quit smoking. And for the young people, I highly recommend that if you are not a smoker, please don't start it, because it's not only about cancer, it's everything about your life. Drink alcohol in moderation, and for men we usually say drinking alcohol in moderation, not more than 2 drinks, whichever you take, the wines or the spirit, not more than 2 drinks. For ladies, one drink is enough for you. Eat a diet which is rich in fruits and vegetables of all types. Maintain healthy weight through exercise and diet. And of course, avoid hot drinks, as we have seen. They are implicated in the as a risk factor of esophageal cancer. For those who have gastroesophageal reflux disease, H. pylori infection, then you should have it treated on time. Thank you very much for watching.